Welcome back to AARC's Big Ideas Theater. I'm your host, Ed Highland, and I've got the honor now of being joined by Georgianna Sergakis, who is going to be talking about the rather popular subject, because it's an important subject, about the tobacco cessation conversation.
Yes.
And, it's a conversation that RTs need to have with the patients, and it's kind of like, sort of, where do you start, I guess?
Well, there are lots of places to start. There are lots of reasons that we should be involved in the conversation, though. And that is because we have this unique opportunity to work with tobacco-dependent individuals. And as respiratory therapists and cardiopulmonary experts, it speaks volumes if we don't address the issue. It's almost like the big elephant in the room. If we come in and we talk about pulmonary health and we don't address that they're a current tobacco user, we're sending a mixed message. We're telling them, take care of your pulmonary health, but there's this huge issue that's impacting your health, and we should be talking to patients about it.
Give us some of the key components of that conversation.
Okay, key components of the conversation. If you just want to start with the fundamentals, you can use the ask, advise, refer model, which means that we are asking every tobacco user about their use, so we're identifying them to know who to talk to. And with the electronic medical record, that's pretty easy to find these days in the hospital. So you can query and get a list of who you need to talk to who are current tobacco users, and then advising them to quit with a clear message that it's important that they quit, a strong encouragement that it will greatly impact their health, and then personalizing that message with something that would make it very relevant to them. And then finally, we should refer them to services. One of the easiest ways to refer them is the National Quit Line, and that is a national service that's provided, and you can even fax a referral. So you can connect them to services if your hospital or institution or clinic doesn't have those resources. You can refer them to someone that does have the resources, like the Quit Line.
Compliance must be a difficult aspect of this, because the patient, knows what's going on. I mean, they're usually quite intelligent about their condition, but they also realize they got this monkey on their back, quite literally.
Right. And they're often apprehensive about having that conversation. So it's really important that as respiratory therapists, you learn some motivational interviewing techniques so that they are comfortable and they feel like it's a safe environment where they can share their concerns about their tobacco dependence. And so motivational interviewing is a great technique. It's a way to have the conversation where the tobacco user would tell you something and then you reflect it back so they can almost hear what their own internal language is. And then you can use all that evidence that you have to help them build the argument to dissolve some of the discrepancies that they might have. They think it's important to quit, but they're not sure how. And then that continues the conversation.
And once again, we're kind of calling on RTs to become psychologists as well as respiratory therapists.
Well, it's an important factor in their health that's impacting a lot of their health outcomes. So it's not necessarily that you have to become a counselor, because I think some people are afraid, the AAR model, that ask, advise, refer model, it doesn't necessarily require you to be a counselor. It just requires you to have a conversation with your patients about it, and the motivational interviewing techniques allow them to feel comfortable so that there can be some sharing. The patient should do most of the talking in that situation.
Some particular resources come to mind, places where you can get that information?
It's so wonderful to actually share that the AARC has lots of resources available to membership and to non-members, actually. But the primary place you can go is the tobacco resource page on the AARC website, and there you'll find a link to a PDF where you can get 3 free CEUs, the Clinician's Guide to Treating Tobacco Use Independence, and there's also a brand new, exciting program, the Clinician's Training for Tobacco Use Independence, which includes the AAR model as part of the training. It includes how to deal with difficult questions, because we often have these questions that we deal with, and it also has information about the pharmacotherapies or the medications that people will have lots of questions about, as well as video vignettes. So you can see some great examples of what that conversation might look like so you feel more comfortable before you try it out yourself.
Great information. It's right here in the AARC house, so to speak.
It is.
Georgianna Sergakis, thank you so much for joining us.
It was my pleasure.
This is the Big Ideas Theater here at AARC.